Okay, so the final disease out of the 6 diseases, this is the final disease that we're going to look at it for today, the tuberculosis. So tuberculosis can caused by they belong to the same genus but different species. So the first one, more common one, is the Mycobacterium tuberculosis. Okay, please make sure that you know how to spell the names. And also another one is Mycobacterium bovis. Okay, so if you look at this Mycobacterium tuberculosis, again airborne. Okay, airborne. So the pathogen live inside the human cells, particularly in the lung. So the lung will be the first site of infections. But tuberculosis is a bit special because the bacteria can actually spread to other parts of the body. So it could cause the different site infection, but primarily this infection will occur in the lung. Okay. So this is how these bacteria look like under this electron microscope. Now, some people become infected and develop TB quickly, while others, the bacteria will remain inactive in the particular individual. So one thing that you need to actually differentiate between the HIV, when HIV is dormant, because we know that HIV infection, it may not be active. Are you clear? HIV just stay inside. But during the time HIV stay dormant, they still can infect others, can be spread to others. But tuberculosis, this bacteria, okay, the Mycobacterium tuberculosis, when they remain inactive, they won't spread to others. This is the thing, they won't spread to others. Are you clear? Okay. So however, the bacteria can later become active, most likely happen to the people with weakened immune system, suffer from malnutrition, and become infected with HIV. So it means that generally, our immune system somehow can suppress it so that it won't become active. But when you are immunocompromised, basically due to, for example, okay, certain disease that weakens your immune system, for example, HIV infection. So that I always say that tuberculosis, Mycobacterium tuberculosis, is the first opportunistic infections that happen to the HIV active patient. Are you clear? HIV positive patient, when they have the weakened immune system. Okay. So TB, how they spread? Always remember, we say infected person to uninfected person by the droplets or the liquids. Tiny liquids. So when the uninfected person inhale these droplets. So as usual, how they spread? When airborne, the site of infection always is your respiratory system or gas exchange system. The lung is the first site of infections. So when it's it's a droplets or airborne. So when we particularly living in an overcrowded condition, when we say sleep together in a large number, homeless, live in poor substandard housing, low immunity because of malnutrition or being HIV positive, these kind of conditions allows the disease to be spread very, very easily. Are you clear? Okay. So when you look at this situation, normally TB, I say that TB can be prevented. Okay, TB can be prevented by vaccination. But when you have these illegal immigrants, we always have this problem with illegal immigrants. Legal one, okay, because they show us they have vaccinated and blah, blah, blah document. But illegal immigrants, we have no way to trace them. Are you clear? Track whether they have vaccinated or not. And normally these illegal immigrants, when come to our country, what they do? They stay overcrowded. One room, 30, 20 of them. So easily spread and actually spread to the local community. When the local community reach HIV patient, you may spread to those immunocompromised patients. For example, those that have received the organ transplant. Because organ transplant will receive the organ from other individual in order to reduce the risk of the rejection. Most of these recipients of the organs, they will receive the treatment called immunosuppressive treatment, means that suppress the immune. Are you clear? Another group of patients that are susceptible to this kind of disease will be the autoimmune disorder. Those people with autoimmune disorder, basically their body immune system too active. They can't recognize their own antigens, self-antigen and non-self-antigen. So this group of people will be given steroids, will be given the anti-inflammatory drugs, will be given the immunosuppressive drugs. So when they are given immunosuppressive drug, basically the immune system become weaker. So TB, this kind of pathogens can easily infect this kind of people. Are you clear? Okay, by who? By these illegal immigrants sometimes. Are you clear? In Malaysia, we actually all of us actually receive BCG. Okay, the vaccine, BCG vaccine, all of us receive it. Are you clear? But again, as I say, that those immunocompromised person, like SLE patient, like HIV patient, they don't have sufficient immunity, even though they are vaccinated. Are you clear? Okay, because they are immunocompromised. So again, as I say, that feature of TB, where you need to know what is the name of the pathogen. I will tell you guys more about Mycobacterium bovis later. Method of transmissions. So it's through the airborne droplets, but Mycobacterium bovis is through the undercooked meat or unpasteurized milk. Bovis, it actually comes from the cattle. Okay, so you drink fresh milk directly, then this bacteria can spread to us. Okay, but majority is due to the Mycobacterium tuberculosis. So incubation period, global distribution, not important, but we do know that site infection primarily infect the lung, but it can spread to lymph nodes, bone, and the gut. Okay, it can spread. The Mycobacterium tuberculosis is actually can spread it, say, to all over our body. So TB patients who have active form of TB suffer of this illness for a long time. It won't be 1 or 2 days. This is very long term. The treatment itself take about 9 months to 1 year. It's not like, normal cough, you take it, right? 2 weeks, it means your cough medication, or you have running nose, something like you take about 2 weeks. Okay, no, this whole year. Okay, as part of their defense, some release hormone-like compound cause a fever and suppress appetite. So people with TB are always presented with this feature. We call it the emaciated. Emaciated basically means that you can see the rib cage. Okay, they like no muscle because they are immune. They lost their appetite. When they lost appetite, they don't eat. Are you clear? Okay, so this is the clinical features that always you can see. And we always know that TB is a first opportunistic infection. Okay, opportunistic infection basically means what? Opportunistic infection basically means that those bacteria or viruses, they won't cause much problem to the immunocompetent person. Are you clear? If your immune system is healthy, no problem, because you have vaccinated. But those immunocompromised, yes, TB always is the first opportunity infection to the HIV positive patient. Okay? So you look at this map and you compare, you can see that the regions of the world. So this map actually tells us a lot of the story. Okay, so this is a part that you need to develop this kind of skill when you answer the question, no choice. Okay, now what this map actually tells us, look at this. First, you can see that the death from TB, you realize that the country with very high TB cases, particularly in Africa, they also have very high HIV or AIDS. Can you see that in terms of the map? So indicate what? There must be a positive correlations. Are you clear? Because TB always is a first opportunistic infections for the HIV patient. Can you see that? So when the country with the high cases of HIV, you can see that. Are you clear? But sometimes you have to understand something here. You look at this. America. HIV cases is high, but why TB death rate is low? Vaccination program. Can you see that? Compared to Africa, vaccination programs are much more higher. Okay. Second, they also have more professional healthcare personality because TB can be treated. They have more advanced in terms of medical treatments, drug, medications, and so on. So that's why their mortality rate is lower, even though you can see that their country have higher HIV case, but TB case is low. Are you clear? Okay. And also you can see that in India, what I want to point out here, HIV is not so high, But you can see that almost on same par as the Africa country when talk about the TB death rate. So we know that the populations in Africa is very, very high. So it means that overcrowded, so TB can spread. Can you see that? So this diagram tells us a lot of the story that you need to know in terms of geography, demographics, features of the country. So sometimes say bio only. No, it's not as simple as bio only. You need to know the general knowledge about the demographic of certain country. For example, India, you know that they're overpopulated. And TB spread very fast in those overcrowded regions. Correct or not? And you know that most of the region in India also very substandard. Can you see that? The healthcare system is not so good, overcrowded. That's why you can see that even though HIV number of cases, because HIV is spread through not through the airborne. If HIV is spread to airborne, I think that we die, means human already extinct already. Are you clear? Okay, so HIV no issue, but we can see that. Are you clear? So some of the country demographically, you have to know a little bit here and there about their healthcare system in terms of general knowledge. Are you clear when I answer? Okay, so one the year actually question asked about this. Mosquito, we do know that female Anopheles mosquito spreads the malaria. Okay, so they actually do the genetic engineer towards the mosquito, so that mosquito may have limited lifespan. But they do it on the male and release a huge number of male. So what is the reason? Why male, not female? You need to know this. Can you see that? Okay, male, because male won't spread the disease. Only female Anopheles mosquito will spread the disease. Okay, so again, another form of TB caused by Mycobacterium bovis occur in cattle. Okay, so previously in 1850 and 1950s, between these 100 years, there's so many people who are death cases. So many death cases is due to this M. bovis, but now we know that we can kill the bacteria through the pasteurizations of the milk. Okay. So how to prevent TB? So again, the only vaccine available is BCG. So generally, Malaysians, you are vaccinated with BCG. Generally, unless that means you miss out. I'm not sure. You can always check back your vaccination records. Okay, again, the herd immunity roughly about 95%. Okay, the effectiveness of vaccine decreases with the age unless they are exposed to TB. Now, what this sentence means? Because we do know that our memory B cell is not very, very long life. Okay, over time, your memory B cell number decrease and decrease and decrease. So it means that one day you might decrease until we have no more memory B cell if or term and conditions you never exposed to TB before. Are you clear? Okay, but if you're exposed to TB, no issues at all, because when you receive or you're infected with TB, your memory B cell straight away will be activated. So once your memory B cell activated, then it will be having these clonal expansions to get more memory B cells. It's something like a revision process. Are you clear? Okay. So another way to do it actually is contact tracing. Contact tracing actually is very, very important, because when you live in the same house, it's something like COVID, airborne, definitely it will spread to others. Are you clear? It will spread to others. Okay, so contact tracing is another method to try to reduce the spreading. And then if let's say the bacteria, we want to reduce the risk, so the milk have to be pasteurized. Okay. In terms of treatment of TB is quite difficult, because as I said that the patient first to be isolated, we won't actually mix the TB patient with other patients, and also the TB patient stay at house. Okay. Particularly if they have this drug-resistant strain of bacteria. So the treatment involves several drugs. I say that we use a combination of the drug, okay? Because we do know that if the bacteria develop resistance to one kind of the drugs, we still have other kinds. Are you clear? We do have plan B, plan C, plan D, plan E used together at the same time. Are you clear? If A won't work, we have B, C, D, E, okay, to kill, okay? Now, the main issues here is TB, the bacteria grow very slowly. When it grows slowly, then some kind of antibiotics or some kind of drug may not be effective. So it will take months or even years to actually complete the entire treatment. For example, 6 to 9 months or even longer, it will take time to kill the bacteria because certain drug actually target the bacteria when bacteria grow. For example, penicillin. Okay, so this type of this type of antibiotic only effective when the bacteria grow. If the bacteria doesn't grow, they won't. Are you clear? They won't kill. So that's why we have to use a correct medication. We always use this what we call the combination therapy. Okay, but nowadays, WHO also promote the DOTS programs called Direct Observation Treatment and Short Course Scheme to ensure that patients complete the course of the drug. The main issues here why the TB or Mycobacterium tuberculosis, this bacteria develop the resistance is due to a lot of time patients think like, okay, after 3 months, I stopped the drugs already. Seems like now, coughing less already, fever less already, no more symptom already. But the bacteria just weakened, they haven't died yet. Are you clear? So those bacteria, the weakened bacteria, you give them a chance to breathe, then they actually start to develop the mutation. They have the mutation, and if they are fortunate enough, you can develop the system to actually resistant to antibiotic. We're going to learn this one in the next lesson, how bacteria actually develop the resistance. But once they develop resistance, whatever, okay, they become active back, and then whatever drug that we used previously cannot be used anymore. Are you clear? Because resistant already. Are you clear? Okay. So therefore, now, WHO promote this DOTS program. The DOTS program actually involves the health worker or even a family member to make sure that patients take their medicine regularly to complete. So keep on reminding, hey, have you taken your medicines or not? Have you taken the medicines or not? Every day. Are you clear? Okay. So it means that you force the patient actually complete the whole course of the medications. Okay. So the drug widely used is isoniazides and also rifampicins, but nowadays these two drugs useless already. Okay, because most of the TB cases in whole world, actually they are bacterially resistant to this. Okay? This piece of information is quite outdated. Okay. So the drug resistant now, multiple drug resistant, MDR TB resistant to at least 2 main drugs used to treat TB. So it means that these 2 drugs no longer can be used. Okay, and nowadays you can see that the outbreak of this with the resistance of 5 of the major drugs now. You can see that. Okay, so we now develop even more, means scary part here, the extensively or extremely drug resistant TB. Okay, means that the resistance of first line drug and the drug used to treat TB basically means that become no drug can be used, suitable drug candidate to be used to actually treat TB because they already develop the resistance. So how the resistance can be developed, we're going to discuss it in the next lessons when we look at this antibiotic resistance. Okay. So how it means to treat TB, because we do know that TB actually can kill because it can spread the whole body, cause the organ failure. Many cases still can be treated with the right combination and rational use of available anti-tuberculosis drugs. Okay, so now we use the combination at least 4 drugs, which is Mycobacterium tuberculosis isolate is likely to be susceptible. So the chance of resistance arise to 4 of them by mutation is reduced to 1 in billions if you use combination. If you use 1, then the chances to resistance is very, very high. But if you use a multiple drugs, I mean a combination of drugs, then we reduce the chance. Okay. So tuberculosis resurgence currently, you can see that in United States in 2015, okay, and also high rate of TB also found in a city with population migrants, again, from the country where TB is more common. Part of London, again, they have rate of TB much more higher than the rest of the UK because there's I will call it metropolitan and a mega city. Those are people actually come in from the whole world to work, to study in London. So those are the places where the TB is very high. And currently, more worried part is because some strain of TB already resistant to drugs, and also HIV, AIDS pandemic. poor housing, breakdown of TB control program, and the drug resistance increase the chance. So therefore, we can see that tuberculosis resurgence nowadays. Okay, TB patients actually is quite common also in Malaysia. Are you clear? Okay, but as long as you are immunocompetent, right? If you use your immunocompetence, then with the vaccinations, you shouldn't be worried about this. Are you clear? You don't need to worry. But as I said that, you need to know whether you have received the BCG or not. Okay, most of the Malaysians, I don't say 100%, but most of the Malaysians, you received BCG before. Okay, so with this, I've done for all the diseases already.